Good morning, good afternoon, and good evening, all. Thank you for taking the time to join this session to hear more about how, through adaptive learning and implementation, HP Plus supported Kenya's government to fast track the budget cycle. We're really excited to share what we did, how we did it, and why we did it. My name is Teresa Ndavi, and I'm a senior economist for Health Policy Plus in Kenya. So, as a way of contextualizing, I will talk more about the why. So, Kenya follows a decentralized governance structure that has one national government and 47 subnational governments, which we call county governments. The budgeting cycle in the country is guided by the 2012 Public Financial Management Act through the medium term expenditure framework and requires all program-based budgeting by both the national and the subnational levels. Now, we noted that there were certain gaps in select national level strategic disease program units within the Ministry of Health and selected subnational departments of health to effectively take part in the budgetary process, as well as especially for HIV, malaria, and reproductive health. Moreover, this year, Kenya will be holding the general elections in August 2022, and this necessitated the fast tracking of the government annual budgeting cycle, which still meant we had to look at how to address the capacity gaps. So the fast tracking is because the national and the subnational assemblies usually approve the budgets, and they are scheduled to disband in April 2022. So this slide is just showing you a pictorial effort about how the budgeting cycle looks like. Now, usually the budget cycle commences at the end of August with the release of the budget cycle by the National Treasury. Now, the circular breaks down the expectations, deliverables, and the timelines within the budget cycle. And there are four main processes, as you can see there. We have the prioritization and resource availability, where the resource envelope is determined and priorities identified, preparation of the budget estimates, and then the legislative approvals by both the national and subnational or county assemblies by the end of June. So here they're looking at approving, of course, the annual work plans, the procurement plans, and the program-based budgets. And then, of course, finally, we have the budget execution, monitoring, and reporting throughout the year of implementation. Now, with the general elections scheduled for August this year, there was a need to fast track the process to ensure that all budgets are approved by the assemblies before they're disbanded. So the process began a bit earlier in July 2021, which was last year, with the release, of course, of the budget circular by the National Treasury. Now, all budgets are scheduled to be approved, like I said earlier, by April 2022, but execution, monitoring, as well as reporting remain the same from June, July this year. So how did HP Plus support the national and county governments to fast track the cycle? So first and foremost, through the dissemination of the budget circular within the fast-tracked budget guidelines to the HIV, reproductive health, and malaria units at the national level, as well as the focus counties. So following this dissemination, both national and subnational levels were expected to generate necessary evidence required for prioritization and justification of the health priorities. These included justification memos at the national level, which were presented to the resource allocation panel of the National Treasury. At the subnational level, we needed a quick turnaround on evidence generation. And so we utilized a tool that HP Plus Kenya developed that uses the Integrated Financial Management Information Systems, what we call IFMIS. So it utilized the IFMIS outputs to prepare public expenditure analysis for health, which are very pertinent when the team is going into the planning and budgeting. We also supported the sector working groups to review performance of the past 3 years and prepare budget proposals and priorities for the next 3 years. We did this by facilitating the planning unit of the Ministry of Health staff to lead these working groups, as well as the subnational treasury staff to lead the working groups at the subnational level, which are their mandates both at the national and subnational. Moreover, we supported consultative discussions between treasuries at both government levels, as well as the Ministry of Health and the county departments of health, to consider increasing investments when setting the budget ceilings. So, what were the results we realized? Well, we saw an increase in the proposed allocations to commodities for HIV, malaria, and reproductive health at the national level, and to the same strategic disease programs within the HP plus focus counties, both of which are heavily dependent on donor funding. And so, as you can see, the proposed allocation to family planning commodities increased to approximately 9.9 million US dollars from 5.6 million US dollars. While for HIV commodities, we are seeing an increase from 12 billion to 15.9 billion US dollars. At the subnational level, we saw increases across all three strategic disease programs. For instance, an increase from 16 million Kenya shillings to a proposed allocation of 24 million Kenya shillings for reproductive health. So you see, from the results, it's clear that both national and subnational governments are taking the sustainability of health and strategic disease programs seriously amidst the various situations they find themselves in, including the upcoming general elections. So here they're trying to ensure that there's sustainability, there's an increase in funding, but also it's business as usual despite the elections coming up. So please visit our website to see various publications, including the one that you can see projected, which gives you an example of some of the evidence that was prepared from the analysis of the IFMIS vote books using the HP Plus developed tool. Thank you all so much for your kind attention, and I hope that what we shared today was very informative. As we get into the question and answer session, it would be great to hear from you all experiences in how you've had it in supporting decentralized governments, knowing that they have different mandates and capacities. Kindly type in your responses and questions in the chat box or unmute if you prefer. I look forward to engaging more with you and learning from your experiences and also what we probably could have done better. Thank you so much for joining this HP Plus End of Project Innovation Cafe, and we look forward to discussing more. Thanks. So please feel free. Let us know what your experiences have been working with the decentralized governments. Oh, great. We have a question from Dara. So Dara asks, what do you see as the major capacity gaps in the budget process at the subnational level? Okay, so thank you, Dara, for that question. You know, some of the capacity gaps we have seen are basically, you need a very collaborative and multi-stakeholder system in order to prepare the budget. However, you find that capacity really lacks with some of the officers at the county level or at the subnational level, but also, say, implementing partners, CSOs, that are supposed to support the planning and budgeting or take part. And so those gaps, when they come in, you find that they're not able to properly influence the budget when they're supposed to influence the budget. And they miss those great opportunities to see how to, request for increases in investment for reproductive health, for HIV, malaria, and health in general. And so it's just a matter of understanding really what is the budgeting cycle, what is expected of the different parties, and from there, they're able to influence. So a lot of the capacity gaps come in understanding really what are the processes and where they can best influence. Thanks, Dar. That was a great question. So what was the source? Thank you, Umuro. What was the source or sources of the high increases in budgetary allocations, given the country's unsustainable public debt burden? So like I said, within the health, within the health in Kenya, that was actually the first sector to be devolved. And so being really heavily dependent on external funding, but also moving to the lower middle income country block defined by the World Bank, really, we realized that external funding would definitely decrease. And so the health sector had to really come in, speak to that, tell them, look, we are getting decreases from external donors, but we cannot afford to, lose the gains we've had. And so the government needs to come in and put in more investment. And so that's why the justification memos were so important. The public expenditure analysis was so important, because evidence really is very important. And so the team was able to really bring out a lot of this evidence and use that evidence, to justify the need for the government to put in more money. And so the results that you saw were the government actually putting in more money for these commodities that are heavily dependent on the donors, as well at the subnational level. Thank you. Thanks, Sonika. Yes, we're really looking forward to hearing how it has been working with decentralized governments, because understanding their mandates and understanding that they still have processes they have to stick to sometimes can prove a bit challenging. So what have your experiences been? What have been your successes that we can probably learn in Kenya for the future? So Citi has come in. Thank you, Citi, for your question. What was the most convincing action that has allowed the Ministry of Finance to increase the budget? Oh, that's a great question. To be honest, evidence plays such a big role, and you have to have the right evidence, and as well as tailoring the messaging to what the Ministry of Finance really listens to. So you have the evidence, but also really packaging that evidence in a way that the Ministry of Finance would be able to understand, and you'd be able to convince them. So bringing out the evidence, making sure it's packaged in a very, very concise way, and presenting it to the Ministry of Finance. That way, they would not have any extra questions. They'd be like, okay, you know what? This actually makes a lot of sense. So understanding what evidence to generate and how to package it to suit the cause. Thank you.